Hello, this is Group 1. Our project is about Emma. The case description is, it is a busy orthopedic outpatient clinic and I'm a PT. The patient comes in and she's a 34-year-old female, status post-rotator cuff repair. In the initial visit, Emma arrives with her supportive husband. She explains that she was attacked and they do know who the perpetrator was, but that she is safe now. In the following weeks, Emma shows significant improvement in pain, range of motion, and functional use of her arm. But suddenly, 4 weeks later, Emma shows decreased mobility and increased pain in her shoulder and arm. With the sudden change in the status, the physical therapist re-examines her scar and the shoulder area, but the scar is healing well and there is no sign of redness or bruising. The physical therapist refers her back to the surgeon to double check, and he sent her back to continue the treatment with physical therapy. 2 weeks later, Emma shows up to the clinic very upset, and she confesses that it was her husband who initially attacked her, and he recently did it again. The physical therapist explains that she must report the incidents, and Emma begs her not to report the incident. What do you do? The process of decision-making using RIPS. Realm, who is affected? Emma, the individual, is affected. Also, Emma's husband is affected, and children, if she has any, friends, family, and co-workers. The individual process. We are emphasizing number 4, moral courage, implementing action even in the face of adversity. We are emphasizing moral courage because Emma begs the physical therapist not to report her husband, but as a mandated reporter, the physical therapist must take action. Identifying the type of ethical situation. We are emphasizing temptation, right versus wrong. Individual may benefit from the wrong choice of action. We know that Emma is not going to benefit from the physical therapist not reporting the incidents of abuse. But Emma feels she will be better off without having her PT report it. But this is the wrong decision. Why is it the wrong decision? What are the possible outcomes for the patient if the physical therapist did not report the abuse? As physical therapists, we are obligated to report abuse or dangerous situations that occur outside of the office. Although there are situations that may be able to be resolved without involving authorities, this, however, is not one of those instances. Ethical principles. Physical therapists should protect confidential patient-client information and may disclose confidential information to appropriate authorities only when allowed or as required by law. Physical therapists should demonstrate independent and professional judgment in the patient or client's best interest at all practice settings. We as PTs feel that it is within Emma's best interest to intervene in this situation and get her the resources she needs to leave her abusive situation. Ethical principles. Continued. The most important of all principles. Physical therapists should report all suspected cases of abuse involving children or vulnerable adults to the appropriate authority, subject to law. Upon the 4 steps to decision making. 1, recognizing and defining the ethical issue. So we recognize that Emma is the patient and she reported to us that her husband is abusing her. But she also explicitly states not to tell anyone else. 2 is reflect on the series of events. Based on our observations of Emma, we see clear signs of a cycle of abuse, from her initial intervention to her later revelation of abuse. 3, decide the right thing to do. Our group decided that the best thing to do was to work in Emma's best interest by reporting the incident to the proper authorities. 4, implementation and reassessment may be difficult depending on what the company's policies are regarding the report of the situation of domestic abuse. So implementing would be to implement the report. Evaluate would be to follow up and find out if Emma is okay and if she did get the help that she needed. If Emma does come back as the patient, it would be best to reassess the situation, find out if she is getting better in her progression of healing, and to continue practice with her. Summary, what is the ethical decision? Abuse needs to be reported to appropriate authority, communication, and to communicate decision with patient so she can ensure her own safety, and continue to perform physical therapy on patients to help her recover from injuries as much as possible. And these are our references. I hope you enjoyed this PowerPoint. Thank you.